So do you guys know what is bipolar disorder is? So bipolar disorder is a complex mental health condition. It's characterized by extreme mood swings that includes highs such as mania or hypomania and lows such as depressions.
These mood swings can significantly impact sleep, energy, activity, judgment, behavior, and the ability to think clearly. According to the most recent epidemiological data published in 2015 by the Malaysian Ministry of Health, the prevalence of mental disorders among adults was 29%. According to the best estimates, about 1% of the population suffers from bipolar disorder, and there are about 250,000 people with bipolar disorder in Malaysia.
Key milestones in the chronology of bipolar disorder in Malaysia might include first, early recognition. It is mean psychiatrists and healthcare professionals in Malaysia would have likely observed and treated the symptoms resembling bipolar disorder in over 20th century, possibly along with other mental health conditions. Okay, so number 2, introduction of modern psychiatry. With the development of modern psychiatry in Malaysia, the understanding and the diagnosis of bipolar disorder would have become more standardized from time to time. So number 3, research and awareness. As Malaysia's healthcare infrastructure developed, so the research into bipolar disorder also increased. So this will lead to greater awareness among healthcare in Malaysia as well as Malaysian citizens about the diagnosis, treatment and symptoms of bipolar disorder. Okay, so last but not least, treatment advancements. The availability of medications and therapeutic interventions of bipolar disorder in Malaysia would have improved over time in line with global advancements of psychiatry and pharmacology.
Now, I'm going to talk about the causes of bipolar disorder. The exact causes of bipolar disorder is unknown. The experts believe there are a number of factors that work together to make a person more likely to develop it. Genetic is one of the factors because the family members of a person with bipolar disorder have an increase of developing it themselves, but no single gene is responsible for bipolar disorder. The other factor is trigger. Stressful circumstances or situation often trigger the symptoms of bipolar disorder. For example, is breakdown of relationship, physical, sexual, or emotional abuse, and overwhelming problem in everyday life such as problem with money, work, relationship can develop to bipolar disorder. Another one factor of bipolar disorder is chemical imbalance in the brain. The chemical responsible for controlling the brain's function are called neurotransmitter and include noradrenaline, serotonin, and dopamine hormone. There is some evidence that if there is imbalance in the level of one or more neurotransmitter, a person may develop some symptoms of bipolar disorder. For example, if level of noradrenaline are too high, can occur episode of manic, while if level of noradrenaline are too low, can occur episode of depression. These are the causes of bipolar disorder. What kind of depression my bipolar disorder patient have? The symptom of depression is feeling sad, hopeless or irritable most of the time, loss of interest in everyday activity, being delusional, having hallucination and disturbed or illogical thinking, and some of them might have suicidal thoughts. While for hypomania, symptoms are feeling full of energy, unusual talkative, and sometimes they are making decisions or saying things that are out of character and that others see as being risky or harmful. Patterns may experienced by bipolar disorder patient is rapid cycling, where a person with bipolar disorder repeatedly swings from a high to a low pace quickly. And the other pattern is mid-state, where a person with bipolar disorder experiences symptoms of depression and mania together. Bipolar disorder type 1 is at least one manic episode that may be preceded or followed by hypomanic or major depressive episode. In some cases, mania may trigger a break from reality. For bipolar disorder type 2, one major depressive episode and at least one hypomanic episode, but you have never had a manic episode. That's how the symptoms for bipolar disorder patient might have.
So, bipolar disorder is a mental health problem that cannot be cured, but with continuous medication and psychotherapy, they can live a normal life like other people. Okay, for medication, doctor usually prescribe mood stabilizer. Mood stabilizer is to control manic or hypomanic episode. For example, lithium and valproic acid. The next one is antipsychotic such as olanzapine and lorazepam. Other than that, an antidepressant can help manage their depression. Let's move on to psychotherapy. Psychotherapy is a vital part of bipolar disorder treatment. The first one is interpersonal and social rhythm therapy. This therapy is to stabilize their daily routine such as sleeping, waking, and meal times. This is because consistent routine can allow them for better mood management. The second one is cognitive behavioral therapy. This therapy is to identify unhealthy negative belief and behavior and replacing them with positive and healthy one. And it also to identify what trigger your bipolar episode. Bipolar disorder cannot be entirely prevented as it's a complex condition influenced by genetic, environmental, and neurological factors. However, there are strategies that may help reduce the risk of episodes, such as have a healthy lifestyle, avoid substance abuse, keep track of mood changes, symptoms, and behavior from time to time, and surround yourself with family and friends.